New Jersey Health Commissioner Shereef Elnahal, thank you so much for doing this. You always make yourself available. We really appreciate that.
Thanks for having me.
Let's talk about the measles outbreak across the country. I know there was an outbreak as well in New Jersey. CDC seems pretty concerned about this, even though I think now it's 500 in some cases. I assume you share that concern.
I of course do, and this is a disease, by the way, that we should have eliminated as of the year 2000. It's a completely preventable disease with vaccination. We are doubling down on the importance of getting vaccinated and spreading that message all across the state. Unfortunately, because we have pockets of unvaccinated people in New Jersey is particularly at risk. Thankfully, we're nowhere near the levels of cases that you're seeing in New York State, over 280 at this point, just in New York State alone. So thankfully, we've contained the outbreak here to only 11 cases so far, but we're very vigilant working with Ocean County to try to stop it.
Should the law be stricter about requiring vaccinations?
I think there are policy ideas that we can think about that will increase the number of vaccinated people. That would be the most important goal, because again, if you have a certain percentage of the population who are vaccinated, you can never get to 100%, by the way, because a lot of people, for medical reasons, cannot get the vaccine. But you're protecting not only yourself, your loved ones, and people with medical conditions. For example, if they're on chemotherapy, if they have immune system disorder, some other reason that they can't get the vaccine, you're literally protecting everybody around you if you get the vaccine.
The CDC put out a travel warning because 99% of the cases, it turns out, was because somebody contracted measles abroad and then brought it here. I saw that the state also put out a warning. What exactly are you concerned in what areas of the world?
Well, in our case in New Jersey in particular, a number of individuals who have traveled from the Middle East and other areas have brought measles. And so this is a time where a lot of people travel, the Passover holiday, the Easter holiday. And so we put out a particular warning, again, doubling down on the message to get vaccinated before you travel, especially if you're unsure if you've gotten the vaccine before.
I was stunned at how measles is transferred. I heard that one sneeze can infect 10 people if they're around you. It's kind of amazing.
It's true. The size of this room right now, if I had the measles and I sneezed, every single person in this room would be exposed and likely to contract it.
Let's talk about the opioid crisis, because I know there's new money in the proposed budget for the opioid crisis. It seems we keep spending money and the numbers keep getting worse. The money specifically, I saw $6 million, or maybe it was more than that, but $6 million was for a database. Why is that important?
It's really important. The money's going to a statewide health information network. So it isn't just a database on a computer. It's the ability for doctors, clinicians, when they're seeing a patient in a substance use disorder clinic, in an emergency room, or really anywhere in the state that's connected to the network, to know what is going on with the patient. That can be a life-saving decision that you would make based on knowing, for example, that someone overdosed just a week ago and presented to the emergency room if you're seeing them in clinic. So this isn't just recording information and reporting it for public health reasons, although that's important. It's also a tool to allow for everyone seeing that patient, no matter where they are, to know what happened so they can make better decisions.
There's a disparity across the country when it comes to the health of infants and mothers at birth and afterwards, maternal health, and especially with people of color, between people of color and people and the white population. It's worse in New Jersey, as you know. But you made an interesting comment. You said that you saw it as being structural racism. That's a pretty harsh statement about where we're at right now. How is it racism?
Well, importantly, I think it's accurate. Structural racism is the legacy of things like slavery, like segregation, the way our cities were built, the way social policy and fiscal policy has been enacted throughout history. What the legacy of institutional racism has done is it's created stereotypes as well in the people treating patients. So this is not conscious or intentional, but studies show that even when you correct for income level, so high socioeconomic status Black women have worse outcomes than women in the general population who have the same level of income. So this isn't just about social determinants, lack of housing, lack of income. Those are important, but it's also about internal biases that we can address directly with training and management approaches at the institutional level to try to stem that tide.
Well, then you answered the question, because I was going to say, if it's institutional racism, it's almost a problem that can't be fixed. If it's institutional racism, it gets fixed over time, but there's no direct remedy. But you believe that with training that could be fixed?
Well, I would disagree with the contention that it can't be fixed. You fix it in one way with better policy that gets resources to communities that have been neglected, that create economic mobility opportunities for communities of color. That's the first strategy. The second strategy is, yes, tackling those stereotypes head on by, number one, allowing for people to understand and be aware of their own biases. You can do that through different exercises, surveys, and different training modules, but then also training folks to, when they are cognizant of their stereotypes that they have, to recognize that early and to have basic protocols in place so that they treat all patients with the same level of attention that they deserve.
The Wanacue Rehabilitation and Nursing Center has been receiving a lot of attention, and rightfully so. The last time I talked to you, we talked about the potential for a criminal investigation, and that call has come up again. I want to get your comments on that when we come back with the Health Commissioner, when Jersey Matters continues right after this.